Hi, my name's Gary. I graduated from Bates College a couple of years ago, and I'm here at USM now in the post-baccalaureate pre-medical program. And I'm here talking to you today. Well, this video is really for you if you have some sort of a language skill, and it's especially for you if you have some language skill. Maybe you're bilingual, and you're interested in pursuing medicine or some pre-health profession. What I'm here to talk to you today about is medical interpretation, working as a medical interpreter. So I interpret for Spanish-speaking patients. I'm actually not a native Spanish speaker. I majored in Spanish at Bates, spent a good amount of time abroad and learned the language well enough to interpret. But medical interpretation can be for people who, have learned the language like that, or sometimes more commonly for people who are bilingual, who maybe grew up speaking Spanish or Swahili or Haitian Creole and also learned English and are competent in both of those languages. But becoming a medical interpreter is actually a pretty easy thing to do. There's an exam you would take to sort of assess your level of proficiency in the language, and following that would be things like HIPAA training, bloodborne pathogen training, all those things that you need to do to work in a healthcare setting. And I think working as a medical interpreter is a super valuable experience for you if you are pre-med for a bunch of different reasons. For one, it gives you really, really great clinical experience. And I'm not talking about necessarily, shadowing experience. You are there, you are observing the physician as he or she works, but you are also, part of the process. You're sort of a linguistic and cultural broker for the physician who's taking care of the patient. And that's a really valuable experience for you if you are interested in pursuing medicine as a career. So I think that's really great. It's also a great opportunity to get to know doctors and physicians and other people in the healthcare world, beyond just a brief interaction that you would get with shadowing. When you interpret, you spend a lot of time with that person, and you get to know them. They might write a letter of recommendation for you down the road, so that's really valuable. And additionally, I think that being a medical interpreter is very valuable because oftentimes when you're doing that, it can be, pretty altruistic work. You're often working with populations that are underserved. And that's a super valuable and I think important experience for you if you do want to enter the world of medicine, because you're working with those populations that sometimes don't have access to medical care. So if you do have some sort of language skill, if you are interested in working with patients in a clinical setting, considering being a medical interpreter might be a good route for you to pursue.